And one of the topics that we are particularly interested in, certainly I myself am personally particularly interested in, is education policy, well-being and mental health, the transition from primary to secondary school, which was actually subject to my own PhD a few years ago. And so I'm really delighted to be able to bring together such an eminent panel of speakers to explore some of the kind of research that Charlotte's going to tell you about that she's been doing, and some of the broader issues that this raises. So I'll start with a bit of housekeeping. So if you are on Twitter/X, our handles are at SMF Think Tank, at UOM Policy, #CPC24. There is no fire drill planned, but if there is a fire drill, outstep and follow the signs. This is being live streamed online. You will see the camera there. So do be aware that this is being filmed live onto YouTube, and if your question is particularly stupid, it will live on the internet forever. Great. So really pleased to be working with Policy at Manchester, the University of Manchester's Policy Engagement Unit, to convene this panel of speakers to address this important and pressing topic of children's wellbeing and mental health. I'm going to introduce the speakers in turn, but we're going to start with Dr. Charlotte Bagnall, who is Lecturer in Psychology of Education at the Manchester Institute of Education, who's going to be telling us about some of the research she's been doing about secondary transition and some of the challenges that raises.
Thank you. Thank you for having me. So as we all know, we're in the midst of a mental health crisis. So in 2022, around 1 in 6 children and young people aged 8 to 16 were reported to have a mental health difficulty. This number has now risen to 1 in 5. We know that mental health difficulties can significantly impair children and young people's quality of life. They're concurrently and prospectively associated with poor academic attainment, social maladjustment, and can exacerbate existing social inequalities and subsequently life chances. So the transition from primary school to secondary school, which is my research area, is a critical period for children and recognised as a heightened risk for the development of poor emotional wellbeing and subsequent mental health. And if we all look back to when we transitioned from primary school to secondary school, this is unsurprising, as during this time we would have faced simultaneous changes in our school environment, our academic expectations, our social interactions, even our sense of self and our identity. And navigating simultaneous challenges simultaneously can significantly impact children's ability to cope. And primary to secondary school transition is associated as a period where children can show declines in their emotional well-being. And this has been shown in my own research, where 2/3 of children report feelings of stress and anxiety around primary to secondary school transition. And this can begin from as early as year 5. So this is actually 2 years before they make that transition from primary school to secondary school. And most of the data says that these concerns can persist, up until 2 years into secondary school. Subsequently, if sufficient support isn't provided at key entrance points, poor emotional wellbeing can predict long-term mental health difficulties. So there is a need for a preventative approach during this time with a focus on children's emotional wellbeing, and there needs to be a gradual progressive approach in order to do this. And this is in line with quite a lot of longitudinal developmental cascade studies, which has shown this link. So to better understand the impacts of emotional wellbeing on primary to secondary school transition, it's important that we look at longitudinal changes in emotional wellbeing during this time through termly monitoring. So identifying emotional wellbeing during this time can then inform early identification of who might be at risk, so who are the children that might later develop poor mental health and need targeted support. So as a first step in doing this, my team and I at the University of Manchester have designed and we're now validating a scale which measures children's emotional wellbeing in the context of primary to secondary school transition. This instrument is called the Primary to Secondary School Emotional Wellbeing Scale. We call it PS Wells for short. And it will add distinct value, particularly at the community level. So it will enable educational practitioners within schools to use the scale to be able to identify who it is at risk, which aspects of primary to secondary school transition they might need support with, and what support could be useful both on a whole class basis, on a universal level, but also on a one-to-one and targeted basis. But following identifying who it is that is at risk and what universal and targeted supports they need, what schools actually need is the resources. So they need to be able to have something to do something to support children. So to overcome this, so alongside the scale, we've developed a curriculum which is called Talking About School Transition 5 to 7. It's a 17-week curriculum, and it focuses on developing the skills that children will need when they transition from primary school to secondary school. So these are skills such as problem-solving skills, what to do if we need help in secondary school, how to make a new friend. And this curriculum takes an early intervention approach, so it starts in year 5, so 2 years before they make the transition from primary school to secondary school, which we know is a key point to intervene. But it also continues into the first 2 terms of year 7, so helps in terms of children's adjustment into secondary school. And our preliminary evidence, so our pilot, has shown that children participating in the programme showed a decrease in transition worries, an increase in transition excitement, and also their coping efficacy. So this is their belief in their ability to cope. And over time, this predicted greater emotional well-being and subsequently mental health. So our aim is to evaluate this intervention at scale alongside using the tools, so the PS Wells measure. And we are keen to work with the Department of Education as well as local authorities to do this. So in terms of impact, there has been some recognition of our early intervention approach in terms of identifying, monitoring and supporting children's emotional wellbeing over primary to secondary school transition by the last Minister for Families, Children and Wellbeing. And we have started to make some national and international progress. So, for example, our intervention has received some appetite by the Department of Education in Australia, where it's recently been implemented, and I was very lucky to be able to go over there. However, now that I suppose we have a new government, we need to start pushing for policymakers and local authorities to engage with the validation and the rollout of this scale at scale. And this is recognising that each year 750,000 children start secondary school, and 2/3 of these children are likely to experience difficulties. So the scale and the importance of supporting children's emotional wellbeing during this time cannot be overstated, as if we don't intervene at this particular critical period, the alarming rates of mental health are likely to keep rising.
Great, thanks Charlotte. I'm now going to turn to Lade Smith, who is President of the Royal College of Psychiatrists, Consultant Psychiatrist at the South London and Moseley NHS Foundation Trust, and Visiting Senior Lecturer at the Institute of Psychiatry, Psychology and Neuroscience at King's College London.
Thank you. So I am a general adult psychiatrist, and I'm also a forensic psychiatrist, and I actually am in charge of all the acute forensic admissions for South London. So I screen them all. And it means I also go and see people who have been referred to us, sometimes from prisons, too often from prisons, unfortunately. I need to tell you that, unfortunately, everything that Charlotte says is absolutely correct, but it's too late, actually. Because I see these people, they're often 19, 20, maybe up to 23, 24, and they have severe mental health problems. And when you look at their lives, you find out about their histories, I think to myself, if only I had met this person when they were 3.
Yeah.
Because we know, unlike physical health problems, mental health problems actually arise in youth for the most part. So 50% before the age of 14, 75% before the age of 24. Physical health problems are actually disorders of middle-aged and older adults. And there'll be many of us in here who have developed our high blood pressure when we were in our 50s, and the arthritis is in your 60s and so on. But by that time, you have your career, you've developed your relationships, you've had your families, you've got your house, you've got all the foundations that mean that when you do become unwell, you've been productive. Hopefully, you've been productive. You paid into the tax coffers. But with children, mental health problems, they arise early, and they can be treated very effectively, actually. And that's often something people don't realise. We can treat mental health problems if we meet people early enough. And you can effectively cure a child's mental health problem in the way you can't do with an adult. By the time if that child isn't treated, they will become an adult with chronic, relapsing, remitting mental disorder, which means that they will be less able to complete school or not do quite so well in their exams. They may get to university, they might be more likely to drop out of university. They're less likely to become someone who is a productive member of society with a good job, paying into those tax coffers, contributing to the country's prosperity. Unfortunately, they are more likely to become someone who is dependent on the state. What we know is that and this is just to say, actually, this isn't just a problem in the UK. This isn't almost, and it's not just a problem in the US or Australia. It's not just a Western problem. The problem of the increase in children's mental health problems is a problem across the world, including in middle income and low income countries. And we've seen suicide rates, for example, in the southeast states in Africa have gone up. If you look at the maps, the suicide rates there are some of the highest in the world. So we know that if you have 4 or more what are called adverse childhood experiences, so if you've experienced physical, sexual, emotional abuse or neglect, then you are much more likely to be someone who has mental and physical health problems as you get older. It accounts for about 12% of binge drinking, accounts for about 40% of unintended teenage pregnancies. It accounts for about more than 50% of the violence that we see in our society. And these people are more likely to have cardiovascular disease, diabetes, and so on. And we know who are the children who are more likely to have adverse childhood experiences because their parents are more likely to be the ones who have substance use problems, for example. And you know that before someone may even get pregnant. So waiting until people get to school to start intervening doesn't make sense. We actually should be thinking about preconception. And the first 1,001 days of a child's life are absolutely crucial. So what we need to be doing, yes, we need mental health support in schools, because the good thing about school is that most people go to school. By the time you get there, you can certainly start to recognise who has the problems. And I'm sure those of you who've worked in education, who are teachers, you know, for the most part, which kids are likely to have the problems. There'll be some kids who you might not spot, but you'll be able to spot quite a few of them. Why do we keep watching those children until it all goes wrong? We should be intervening early, with the families, because we can say these families are high risk. We need to support them early so that we can identify who's got the problems. We need to make sure there's mental health support available, not only in the schools. No point just having some counsellor who's not trained and not skilled. They have to be skilled, they have to be trained, they have to be linked in with statutory mental health services, that's children and adolescent mental health services, which have to be sufficiently resourced to manage the massive problem that we currently have now. Thank you.
Thank you. I'm now going to bring in Rachel de Souza, who is Children's Commissioner for England, and before that led 2 schools and the Inspiration Trust.
Thank you so much. Colleagues, it's great to be here, the start of my conference, so I'm absolutely excited to be here speaking on this panel. So I was a teacher for 32 years, a head teacher for 20 years, and I ran a group of schools, mainly in disadvantaged areas, and was absolutely committed to the belief that kids in disadvantaged areas could do as well as any other with the right teaching. And all that was going along fantastically until the lockdown. And the perspective I kind of want to bring in is that I went to school every day during lockdown in Cromer, and we did food banks for all our schools. We were giving out beds, but that was the first time that had happened since the Second World War, and I was deeply concerned about what the impact was going to be. And the more I looked at it, that the impact of schools closing and all those things we were telling children, like if you go out, you're going to catch some terrible disease and you can't see your grandma because you might kill them. All of that was having a deep effect, and locking them away and them being on their computers all the time instead of out playing in the fresh air and all the things they needed to do. So when the Children's Commissioner's job came up, I took it because I truly believe that the things I'd dedicated my 32 years to were not going to cut it afterwards. And so I took this role because, in my view, we were going to need to deal with all the issues that were coming out of it by getting all services to work together. And the biggest thing we were going to have to deal with was the kind of mental health anxiety issues that were coming out of lockdown. Now, the first thing I did was my big Ask survey. I got 500,000 responses. To date, I've had 1 million responses from children. There are 8 million children under the age of 18. And in that first 500,000, I asked them, what are the biggest barriers to you thriving? Mental health anxiety concerns. Now, they don't differentiate between the kind of really serious and mental health issues and the anxiety issues, but it was absolutely their number one concern. They wanted to go back to school. They wanted to, they loved their teachers just after lockdown. They were ready to get back. And of course, what did we find? We've still got 1.6 million or 7 million children persistently absent. Unbelievable, unthinkable. When I go into schools now and look at absence rates, that would not have passed muster before lockdown. And that 100,000 plus who are completely missing from education, double what was before. Now, this is a familiar story to you, so what should we do? The last government tried to do some important stuff. It started to roll out the mental health support teams. It set up a National Attendance Alliance. I didn't think that National Attendance Alliance was working. So I asked to be the independent chair of a Manchester Attendance Alliance and pulled together 11 local authority chief execs, DCSs. We trained 230 schools just over the last few months. When I dug down into their data, because you can only get stuff done locally, truthfully, you can have great big national whatever, but it's local where you can actually do things. When I dug down into their data, why were children not at school? And this plays to the points that have been made. When I looked at the millions of days missing from Manchester children, and we had health there, we even had dentists there in my Attendance Alliance. When we dug down, it was Fridays, it was transition, so children falling off at transition points, and it was older teenage girls. Real concerns. Now, my Manchester work has been about trying to make sure health, everybody are working together with education to overcome these barriers to get kids back to school, because back to school with their peers is where they're going to be happy. So absolutely right, the point about family. We need to be supporting family life, a good family life, but we also need them back to school with their peers, with normal growing up, boundaries, thriving off those PlayStations and actually in there doing what they should. All this summer, I think, was an absolutely existential moment about childhood for me. We've had riots right across the country. We've stopped talking about it. I was in Spellow Library last week, the library that was burnt down, with the kids from the school across the road, asking them what they felt about that. I was deeply concerned. As Children's Commissioner, I'm going to go get to see those children who got custodial sentences as part of the rioting. Before I did that, I flew over to Norway, because I wanted to see what they did with their justice system. Now, I'm not saying right or wrong, but just a different approach. I looked at all services over there. When you're arrested in Norway as a child, you go to the Barnehus, which has social workers, youth workers. It's run by the police. The Oslo chief of police said to me, "Why are you locking kids up, Rachel? They're only going to do it again." They've got dentists because they see lack of dental care as neglect. They're absolutely focused on the family and children being able to take risks, get out and walk on the streets, play outside. Completely different model. What struck me, and that scales fell away from my eyes. Look, they've got the Sovereign Capital Fund and are taxing everyone, and but what struck me was how well services work together. We could do that. Health could be wrapping around. Health was leading. In many of the countries I've seen, but in Norway, leading on safeguarding, leading on supporting children's wellbeing. Education was listening and being guided to that. Everybody was committed to getting the children into school. Your sentence, if you committed a terrible crime as a child in Norway, I was looking at sentencing, you're going to go to school every day. You're going to play football twice a week. You're going to have an adult mentor from the community who's going to talk to you every week. I went and met the fewer than 10 children in prison, because you triggered me because you were talking about that. And they were like, "Oh my God, they talk to us all the time." It's like, really, it's like, you've got to get better here. We could do so much better. And my challenge to Damian and to and I think this is a place that, as shadow, as the opposition could be, is We need to revivify and value childhood, family, making sure that children can get back to school and making sure that services can work together to really support children properly. But just like the value of, for its own sake, proper play, being outdoors, have great play with your peers, going to school. These are the things that will stop the anxiety crisis as opposed to the mental health concerns that need genuine intervention. So I'll shut up there.
Thanks, Rachel. Great. And now I'm going to turn to Damian Hinds, current Shadow Secretary for Education, former Secretary of State for Education, and holder of many roles across education policy for 14 years in Parliament.
Thank you, and thank you very much for having me. Thanks to everybody for being here. It's great that the SMF and the University of Manchester have done this event, incredibly important subject. I think we're all very fortunate to have heard from 3 excellent presentations, and not for the first time in my life I find myself not disagreeing with the word that the Children's Commissioner has just said. I think there's some really, really important messages here. I don't want to sort of depress people, but this is a really serious subject. So it's within my political lifetime, within my time in Parliament, that we used to say 1 in 4 people will experience a mental health illness during their lifetime. But it would appear that 1 in 4 children, teenagers, may have a mental health illness now. And that is the way that the world has changed in that short period of time. Let me show you a chart, if I may, see if I can move this way. So this is the chart that should, well, it's one of the charts that should concern us. Well, you don't need me to explain it to you. This is a time series chart with a pretty flat line, and then a very accelerated line of what the NHS call probable mental health disorders. So this isn't children saying I've got a mental health problem. It's them answering a series of questions from which the NHS mental health service infers that this individual probably has a mental health condition. Really important point to note here, and I agree with exactly what Rachel said about all the problems with COVID, that acceleration predates COVID. This is a really, really fundamental point. The other thing, and this is like, I'm not going to give a number because you don't need me to. If you extrapolate that line out and think about the point at which you get, to somewhere where like the majority, I mean, it's not going to happen because lines never actually plot in pure straight lines, but you can see why it's a cause for some concern. Already, if you look at a slightly older age group, so university students, there's a study by Young Minds, study of a supposedly, I'm told, a representative survey of 1,000 undergraduates where 27% had a diagnosed current mental health issue, and even more had a sort of self-reported mental health issue. So we don't know. I mean, I think it's probably fair to say, I'm looking at the academics today, we don't really know what's behind this increase. I mean, it must be some combination of there's greater diagnosis, greater awareness, perhaps some degree of things that historically we might have called just part of life, we now have terminology for, and then the fourth thing, which is some increase in underlying prevalence of actual mental health conditions. And I think it's fair to say that, and certainly nobody I've spoken to yet, and I've asked this question of many academics, clinicians, educators, and so on. I don't think anybody really knows what the balance is between those factors. Another really important point, and Dr. Smith touched on this, is this a British phenomenon or is it an international phenomenon? And it's quite difficult coming across truly comparable data. In fact, there is no truly comparable data across countries. But some other health services do a similar sort of thing to the NHS mental health survey. I think here we've got the United States and France. And you don't need to be able to read all the numbers to see that basically the shape is the same. It's a kind of like a flat, and then it takes off. The second big question is, we only know right now what's happening to this in this generation. A really important question for public policy in our society is, does an increased prevalence of, or apparent prevalence of mental ill health in young people translate, will that same cohort as they get older have a greater incidence of mental health conditions in adulthood? And we don't know that, I mean, by definition, because they haven't come through yet. But we do know that already, and again, this is something which has changed even in my time, in my 14 years in politics. We're already at the point where mental health conditions are the number one reason for adults of working age not being in work. I'm going to skip over, there's too many numbers here, too many numbers. Suffice to say, if you look around the world at different countries, it is not the case that Britain stands out as being, huge levels of anxiety, huge levels of depression compared to other places. UNICEF did a survey across 21 different countries, and as Dr. Smith says, you look at high-income countries like ours, lots of middle-income countries, you get different patterns. Some things we score particularly highly on, some things we actually score fairly low on. It seems to be, broadly speaking, these issues occur in many places around the world. And then you ask the question, well, why? And as I said earlier, we don't know, is the truth. No one really knows. But we've got a few clues. One of them is if you look at in the PISA study, so PISA, which is an OECD study that looks at many different countries across the world, most people concentrate on the bits that talk about educational attainment, but there's lots of other things in it as well. And if you look at what are the key causal factors, what's the positive correlation with happiness or unhappiness, general life satisfaction, the number one thing, we don't talk about this very often, do we? This is the number one thing internationally. Number one thing is your relationship with your parents or guardians. And then the various other things that come below, life at school, health, possessions, how you look, don't be too surprised with that, with teenagers, your friends. These are all like normal things about childhood. The other thing that actually it's really difficult to really pin down what its role is in this, but anybody who ever speculates, I think feels themselves on fairly safe ground to say that social media plays a big part in what has happened. And obviously it is intellectually and academically invalid to just point out a coincidence of timing. But if you look at where that inflection point is on the line in probable mental health conditions, it pretty much coincides with the growth in children's access to and use of social media. So what do we do? First of all, we need to reduce harms at source. And we know that social media is, it is a reasonable assumption that social media plays a big part in this. And so reducing the harm that comes from social media has to be a big part of the solution. That's both about content, and on that side, I would say that the Online Safety Act and so on is only stage one. Do not think that because we have legislated for something, therefore the job is done. It just has to be implemented. By the way, it also still has to be implemented, but there will be more we have to do as well. And of course, we should look at the wider pressures on children, and actually primary to secondary transition is a classic point. And Rachel, to your point about attendance, we know that you get a drop off in year 7, actually get another drop off then in year 8, which is interesting, perhaps because kids do have a lot of focus on them in year 7 when they're new in school, and then perhaps a tiny bit less in year 8. But I think we have to be careful about overdoing the reducing the pressures, because pressures at school and challenges to be got over, they are a part of growing up. And if you don't experience them in school, then when are you going to experience them for the first time? I think what's important is that children feel supported, that they can cope with those challenges, they can face up to them. And if they don't succeed first time, it's not a disaster. There is always another opportunity. On the acute help front,